Well, good afternoon. Thanks for joining us. I'm Todd Sears. I'm the founder and CEO of Out Leadership. And I want to welcome everybody to our next in our series of our Leadership Lounge. I'm joined today by three amazing leaders from the LGBT nonprofit community. And we're going to have a great conversation today about how the LGBT nonprofit community is navigating the COVID crisis, how we're still pushing forward for equality in this current time, and importantly, what each of you out there can do to support the movement. Before we start, I want to give a little bit of background on a few things. One, if you're not familiar with Out Leadership, I founded the organization 10 years ago, and we have become the oldest and largest consortium of companies in the world advocating for LGBT equality, developing LGBT talent, and creating research and insights. We had last year 59 events on 4 continents. We've convened over 80 we have over 80 member companies, almost 500 CEOs we work with. And what's exciting to me is in this current time, we've been able to pivot our work, not just virtually as the leadership lounges that we're seeing today, but also my colleague Dar is continuing our equality imperative leadership conversations virtually. My colleague Rufus Gifford is doing the political conversation. We just had a conversation last week with Sean Patrick Maloney to discuss the stimulus bill. And Fabrice will actually be having a conversation tomorrow with Sean Straub discussing HIV and COVID and the challenges following on the COVID and HIV conversation that we led 2.5 weeks ago. I also want to give a special welcome to all of the folks who are supporters of HRC, of Lambda, and of GLAAD. And a special welcome to the moms. I want to give a special thanks and a hi to my mom and my mother-in-law, both of whom are watching. It's always nice to have family support, so thank you. The final thanks I want to give are to the 80 member firms of Out Leadership. We could not do the work that we are doing now globally and continuing to do without your support. I'm proud to say that all of our firms have given support to us. We have not lost any of our member firms or any of our sponsors thus far. And in the current environment, that says a lot about our firm's commitments to equality, to developing LGBT talent, and to making sure that our community advances. I want to give a special thanks to a few of our member firms who have been very supportive in the past couple of weeks. Baker McKenzie, Barclays, Capital One, Dow Chemical, LinkedIn, Macquarie, Morgan Stanley, PGEM, and Nomura. And I want to give a special thanks to our global sponsors, HSBC, Ropes & Gray, RBC Capital Markets, and KPMG. Each of these firms has a strong commitment to equality, and interestingly, of the firms I mentioned, almost all of them additionally support GLAAD, Lambda Legal, and HRC. So I want to thank them not just for supporting Out Leadership, but for supporting so many organizations in our movement. It really does make a big difference. So before I turn it over and introduce our speakers, I wanted to read a couple quotes that have been in the news in the last couple of weeks, because I think they're a good framing for us. And as a starting point, as I was thinking about this conversation, one, I'm so thrilled that we have 3 of my friends who have been friends and colleagues for a really long time, who are willing to join us, and who are also really fighting hard in this movement. It is heartening to me to see the support and the community come together. And that's really the framing that I want to have for this conversation today, because as a community, we have been through a lot of challenges. Hopefully everyone saw the interview with Larry Kramer in the New York Times a day and a half ago, where he said this is now the 3rd plague that the gay and lesbian community has had to go through. And there were 2 quotes that struck me, and one was from our friend, Dr. Fauci. And if you've seen any of the press conferences, it's nice to have at least one adult in the room, and Deborah Birx as well. But he said yesterday at the podium with Mike Pence standing right beside him, something that I thought was brilliant, and I wanted to start with. He said, when he was talking about, he actually referenced the AIDS crisis and the HIV crisis. And he said, during that time, there was extraordinary stigma, particularly against the gay community, Fauci said, as Pence looked on. And it was only when the world realized how the gay community responded to this outbreak with incredible courage, dignity, strength, and activism that I think really changed the stigma against the gay community, very much so. When you're in the middle of a crisis like we are now with the coronavirus, it really does ultimately shine a very bright light on some of the weaknesses and foibles in our society. And I love that for 2 reasons. One, because he spoke about how our community overcame stigma, even in the darkest times of our community, but also pointing out the fact that this disease is not an equal opportunity disease. It is affecting the most vulnerable communities in our country right now. It is affecting Black and brown people. It is affecting people under the poverty line. It is, of course, affecting LGBT people. The Williams Institute did some great research a week and a half ago showing the count of the LGBT community that will be affected, the trans community. All communities are being impacted, but even more so some of the most vulnerable. And I think, again, that is an opportunity for our community to lead. David France echoed that, and he said, pandemics never hit fairly. And if you know David, he's the one who wrote How to Survive a Plague, and he's an amazing documentary filmmaker, and he just did Welcome to Chechnya. He said, what we have now appears on its face to be a more democratic plague that isn't confined mostly to a despised population as it was with the gay community. It has still been most heavily concentrated in the major urban areas, which is blue America, in the neighborhoods that are filled with people who are not rich and are often black and brown. And the final quote I want to share with you that I got a bit of a kick up was Cleve Jones, who said, during AIDS, I was disposable because I'm a faggot. Now I'm disposable because I'm a fogey, which from a sort of keeping a bit of sense of levity, but also the seriousness of this, I think that was a very apt point. So with that, I want to introduce our three amazing speakers. A couple of sort of ground rules that I've shared with them. We're going to try to have as much of an interactive conversation as we can. For those who are on the line, and almost 340 people have registered for today, so really excited to have that much of a great audience. If you do have questions, you can type them in the sidebar. As we go through, I will do my best to incorporate them into the conversation, and we'll hopefully have a fantastic conversation here. Just starting around the round robin, to my right at the top is Kevin Jennings. Kevin is the CEO of Lambda Legal. I've had the pleasure of working with Kevin for many, many years in his numerous roles in the LGBT community, from founding GLAAD through to leading the Arcus Foundation, the Tenement Museum, and now CEO of Lambda Legal, where I'm a proud board member. I'm very honored to have Kevin. A fun fact that we just learned just literally before we started about Kevin was that his first job in New York was for Taco Bell. And I'm just going to leave that there, and maybe he can comment on that when we start. Directly below Kevin is Sarah Kate Ellis, CEO of GLAAD. Sarah Kate has been in the media industry for a very long time. She was at Real Simple, and she's led GLAAD through some amazing, challenging times, and has really, I think, reinvigorated the organization with a lot of great initiatives, and truly made it the world-class organization that it is. Sarah Kate, interestingly, also worked in a restaurant, but it was very short-lived. And the fun fact for Sarah Kate is that she's the great granddaughter of George Washington, niece of George Washington. And last but not least, Alphonso David, the CEO of the Human Rights Campaign. Alphonso, interestingly, started his career at Lambda Legal, which I think is a post-law school amazing fun fact. I've had the honor and pleasure of calling him a friend for 20-something years. We'll just let the grays in our beard tell exactly how long that has been. But in addition to leading the organization into a new era, which he literally kicked off with a bang his very first day, which I was very proud to see. Alphonso served for the governor of the state of New York, Andrew Cuomo, for 12 years as counsel to the governor. And at some point today, we're going to have a conversation about the governor and his brother, who's cuter, who's funnier, what's the sense of humor there, without putting your life at risk, Alphonso. So I want to thank all three of you for joining us. And I want to just start broadly with a question about how the organizations themselves are feeling right now, how you're navigating this with your staff. We'll talk about donors in a little bit, but just kind of give me a sense of the mood and how you're maintaining the morale that's necessary to keep the work going. And I'm going to start with you, Alphonso. If you can just kind of give me a sense of things. How are things at HMC right now?
Thank you. Well, thank you, Todd, for holding this, and I'm really happy to join all of you today. So at the Human Rights Campaign, what we're doing is really reimagining how we engage in effective advocacy. As you mentioned in the opening, we have faced challenges as a community. We went through the HIV/AIDS crisis. We've gone through many crises before, and we will overcome this one as well. So at the Human Rights Campaign is an organization that, as many people may know, has been in existence for more than 40 years. The Human Rights Campaign is engaged in the struggle for equality for LGBTQ people, and making sure that we constantly push the envelope to make sure that we're treated fairly in every single facet of our lives. We now have to ensure that we can do that work effectively using new approaches. We have to reimagine the concept of effective advocacy and how do we achieve that in the virtual space? And so the team is really reformulating, recalibrating the approaches that we're taking to all of our work. We do political work, we endorse candidates, we also do a fair amount of programmatic work and policy work throughout the country, and we do education and outreach work. So taking a step back and really thinking about how do you impact culture, how do you impact in the political space, how do you impact policy in an effective way is what we're doing right now. And as we do this work, I also have to be mindful of the folks that do this work, right? Very, very dedicated advocates, people that have been doing this work in some cases for decades, and reminding ourselves that we have to think about the folks that are on the front lines that are doing this work, pushing and pushing and pushing for equality. So much so that I ended up singing happy birthday to one of our members, one of our staff members recently, because we're all sort of, cabined in our homes, in our conference rooms, in our office rooms or office spaces. And we've lost that human interaction. We've lost that social touch. And it's really important as we do this work, which is even more important now than ever, that we remember how important it is to connect with our teams and do that in a very personal way.
So actually, maybe there was a cabaret singing background that you had as well that we just didn't talk about. I think and that's a nice connection to Kevin, because Kevin did a birthday video from a Lambda perspective as well. So maybe you and Kevin are sharing notes here. Kevin, how are things at Lambda?
Yeah, we went virtual as well on March 16th. And we've been doing a variety of things to try and stay connected. Like we have a virtual happy hour every Friday at 4 o'clock for the people in our 6 offices across the country. I think because our staff was already very dispersed, we have offices in New York, Washington, Chicago, Atlanta, Dallas, and Los Angeles. People were used to being on video conference, so it wasn't that big of an adjustment. But definitely the stress and the isolation is hard for folks. So we've worked hard to find ways to stay connected. One of the other things that's hard is that, contrary to the popular imagination, the courts have not closed. Our work is continuing. We're still filing lawsuits. We filed suit against the Trump administration 2 weeks ago for trying to suspend the rules that prohibit discrimination based on sexual orientation and gender identity in the provision of programs through the Department of Health and Human Services.
Yep.
And believe it or not, a week ago Monday, the state of Idaho, the governor of Idaho, Brad Little, signed 2 new laws targeting trans people.
Yeah.
One that would ban trans athletes from competing in school sports, and the other one which would ban trans people from correcting their birth certificates, their gender markers on their birth certificates. It is absolutely amazing to me that in the middle of the worst global health emergency that we have known in our lifetime, that the governor of Idaho has the time to target trans people. It's amazing to me. So we're preparing to respond in court to that. I sort of think of the right wing right now. It reminds me, I'm a big fan of the Terminator movies. They're sort of like the Terminator, like nothing stops.
They don't stop.
They just keep coming. Not even a pandemic stops them.
It's unbelievable.
So I think the fact for our staff, one of the things that unfortunately is the case is that we have had to keep working through this. And that's hard when people are trying to take care of kids and elderly parents and they're worried for their own well-being. It's been very stressful to continue to do the work when our opponents are up to such nefarious things. And we're all worried about the well-being of our loved ones, yet still having to fight back against these actions.
There's so many industries in that way, right? Our medical professionals and the folks going to the grocery store and the advocates as well. Sarah Kate, tell me about GLAAD. I know you guys are continuing the hard work as well. And how's the morale and how's the staff, and how are you and the team holding up?
Well, thanks for having me, Todd, and hi, everyone. So we at GLAAD went virtual March 12th, and we were founded in a crisis. We were founded during the AIDS crisis, an epidemic, with the idea of being the watchdog, and especially around the coverage by press, media, and journalism. So for us, I think this is a natural state for us, in that it's our foundation. It is exhausting though, because we've become used to crises. Every day crisis comes is 24 to maybe 72 hours. If you've got a big crisis on your hands, it might last 7 days, but really the cycles move so quickly.
Yeah.
So this is about sustainability, because this is a crisis that's not ending, and there is no end in sight, right? So I feel like for us, it is, as both of my colleagues mentioned, about isolation too. Our community already deals with severe isolation,
right.
And from our perspective, we have a lot of people in our community that are now in their homes that are hostile environments,
Very much.
not accepting environments, especially our youth. So we feel inspired by this moment to reach out, to make sure that people know that we're here, that we're watchdogging, that their community is still alive and vibrant and happening. And so I hope a lot of people are tuning into this to see that today, the leaders of the community coming together. But I think we do the virtual happy hours. I've individually called every staff member so that I have an open dialogue. I think it's really important. Connection is critical right now. Absolutely critical in this time. And so we're doing, like so many other people are, little things to keep connected, happy hours. And in our all staff meeting, we go around, we're smaller than some, but we go around and everybody says something good that's come out of being at home. A project done, book read, or a show watched, or a connection made. So we're trying to focus on some of the positive.
That's good. That's important. And from an out leadership perspective, we're doing the same. We've got the virtual happy hours. We did a buddy system, actually. So everyone on the team has a buddy that is not their direct manager, so people can check in every day with their buddies. And we're instituting the summer Fridays early, because I think everyone is exhausted, and I'm finding that everyone's working a whole lot harder now, actually, in this time, because as Kevin mentioned, the work continues. And virtually, it is actually even sometimes harder. So I'm a little struck. There were a couple of things that I noticed, actually even the news today, just in terms of our community and showing up with the COVID virus. So many jurisdictions, including New York State, actually, are not tracking sexual orientation and infection rates, which means that as a community, we're not being counted. And if you think about that more broadly, one of the things we're going to talk about in a couple minutes is the FDA blood ban. But before we get into that, I think as a community, each of our organizations, and there are obviously so many organizations that are not represented today. So I want to also thank all the organizations that are out there doing this work. But as a community, everyone sort of having their lane and sort of attacking the things that are in front of them in their lane is where I'd really kind of like to start. So, Kevin, you mentioned, I'd like to do Kevin and Sarah Kate, then Alphonso. Let's talk a little bit about the key elements of the work that you're seeing right now. So you mentioned the right wing. There are so many elements, even the tent that's in Central Park that's funded by Billy Graham's, evangelical Christian organization. And what I love about that particular example is that the head of Mount Sinai is a gay man who specifically had to navigate, who they turned down a homophobic organization for Save Lives. And what I loved that he did was he actually made it the requirement that they couldn't proselytize in the tent, and they couldn't turn anybody away based on any of their religious beliefs, that they had to be inclusive. And I think those are the kind of navigations that have to happen. But also, I love that it was a leader in our community, because we are everywhere. So with that, Kevin, you mentioned Idaho, obviously the lawsuit there, and I know Lambda's already filed countersuit. Give us just a couple of pieces of Lambda's work that are continuing, and then Sarah Kate and Alphonso as well.
Yeah, I think that one of the things that is really important for us is to keep our helpline operational during this time. We take over 5,000 individual calls a year from people who need legal assistance. And we make sure that every single call is returned and that somebody is connected to an attorney who can provide them with support. So we're very concerned right now, particularly about people being discriminated against in the provision of healthcare, and particularly the trans community, because we know that this is a consistent and persistent problem for trans people. And right now, more than ever, this is going to be a matter of life and death for people. So our helpline is continuing to take calls. It is continuing to be operational, and we are continuing to provide support to people. So I think that is one of the things that we were very concerned about when we went virtual, was making sure that our helpline continued to be functional during this time. We wanted to make sure that people who needed legal assistance could continue to access that through lambdalegal.org. So I want to make sure that people know that Lambda's attorneys, and every call is taken by an actual attorney, so that you are reaching someone who knows the law and can provide you with immediate legal advice. So I want to make sure that people understand that Lambda's attorneys are still standing by and are still available to provide you with guidance and resources and connections should you be encountering problems as you try to access the healthcare that people so desperately need right now.
Kevin, thank you for that. Two quick things. One, as a follow-up to this, we'll be sending out links that each of the three organizations will be sharing in terms of resources that each of the organizations have created. Separately, a little housekeeping moment. If all three of you can click the little bell at the top of the screen and make sure notifications are silenced. And if you've got your cell phone, and we're getting a couple dings and things.
That's where the dings are coming from.
Yeah. And our friend Jen is like, Jen out there is like, who hasn't silenced their notifications? Thank you.
I hope I did. I'm not sure I did it, but I saw that note. I'm flying solo here, so.
Excellent. So thank you for that. So Sarah Kate, give me a flavor for how the work is continuing with GLAAD and what folks need to know here.
Yeah, so from our, we went into watchdog mode as we do, and I think what we saw right away was when the Surgeon Attorney General got up there and started talking about blood donations. This is something that we've been working on for a long time, and we saw this as an opportunity to kind of move that conversation forward again. So basically, the story is that in the 80s, they being the FDA, stopped gay men or men who had sex with men from donating blood. And then in 2014, which was then put into place in 2015, they changed it from forever that you weren't allowed to donate blood to a 12-month waiting period. So they call it a deferment period, meaning that you could not have had sex in 12 months in order to donate blood. The Williams Institute, who you talked about earlier, did a study a couple of years ago, that says that 1 million lives are not being saved because of the amount of people that would give blood, of men that would give blood if they were allowed to. And this is something that we've done videos with Alan Cummings on about the blood ban, and something that we've been really active in. And we saw this announcement saying that there's a shortage of blood, they need blood, and also as a lot of this conversation has been around the plasma, right? Like testing the plasma, seeing who has survived COVID-19. And so we started with a petition, we started with public pressure and a media campaign around the FDA lifting the ban. Like, what better time than in a medical crisis? And what people need to know about this blood ban is that it's not rooted in any kind of medicine. It's rooted in complete discrimination.
Completely.
So anybody who donates blood is tested for HIV. The technology and the science is there. And so this is all based on stigma, leftover stigma from the AIDS crisis. And so we were successful with other people to move this to 3 months. So a 12-month deferment went down to 3 months, which was, a lot of people were criticizing us as we were coming out on this, saying like, it's not the right time, don't do this, they're not going to move. And I felt like there's no better time than a crisis. And when we actually need the blood, and you have people who want to donate the blood. So we're still very busy on that, though. We have medical experts that are about to start speaking out about it, because we want it down. It should be nothing. There should be no deferment period of time. So that's one thing. The Franklin Graham thing is another one. We saw this happening. We briefed the press on Franklin Graham, on his stance on the LGBTQ community. He is very anti-LGBTQ. In fact, he makes you part of becoming a part of his establishment is that you denounce marriage equality. So we were, it is a fine line though, right? You have saving lives and then you have discrimination. And so we were happy to see what went on with the president of Mount Sinai and all of that, but we are watching it closely. Mm-hmm. And so those are the moments that we are looking out for the community. The other thing that we are looking out for and that we're going to announce shortly is that we really want to help the smaller community organizations, LGBTQ organizations throughout the country. I'm very concerned about the infrastructure of our community during this time because we're already functioning on razor thin margins, if any. And so what we want to do is we're going to do a fundraiser for local communities, community organizations across America.
That's great. I think that's awesome. I know Jessica Stern at Outright is doing a similar sort of rescue fund, which I'm very excited about. And let's take the FDA blood bank because I think that's a great jumping off point for collaboration in the community. I know HRC and Lambda have been working on that for the last 30 years as well and filed suit. And so maybe Alphonso and then Kevin, let's kind of fill in the picture. So Sarah Kate was sharing some of the recent pieces GLAAD's been doing. Maybe HRC Lambda piece on the FDA blood ban as well.
Sure. So as you know, during this crisis, we have to really be mindful of how policy is disproportionately impacting LGBTQ people. And I'll talk about our political work in a minute, but let's just talk about the programmatic work. So as Sarah Kate was mentioning, the blood ban went into effect in 1983 during the AIDS crisis, when there was really no significant consistent testing of the virus. And so they implemented this blanket blood ban that effectively said gay men and bisexual men cannot get blood. And that policy was not changed until 2015, and it went from a blanket ban to 12 months. The Human Rights Campaign and Lambda Legal have been working sort of collaboratively behind the scenes with the FDA, with elected officials, to change the policy and make sure they understand that this policy is not driven by science. This policy is really driven by bias.
Yeah, exactly.
And so as recently as November of 2019, we met with the American Red Cross which is one of the major blood banks in the country, to make sure that they would change their policy. And we've still been engaged with advocacy with the large blood banks around the country, as well as the FDA. What's interesting in terms of different approaches is you see, the approach that GLAAD took and the approach that Lambda Legal and HRC has taken on a similar issue. We thought it would be much more effective to sort of, work with the FDA behind the scenes, work with the blood banks to see if we can get them to change policy. And I think all of those actions were impactful in getting the policy to ultimately change, because a lot of the folks that are making these decisions view themselves through the lens of being technicians and experts in really developing public policy. And sometimes will view public pressure negatively, and it may affect how they will actually change policy. So all of those actions were helpful in getting us to the point that we are. Yeah. But as I said last week, and I'll say again, this is not a victory. What the FDA is doing is perpetuating a biased policy. And we have to make sure that we eradicate that policy, because it shouldn't be based on who I am as a gay man. It should be based on risk factors. And that is what we've been advocating since the 1980s. And they still haven't changed the policy. But I'll turn it over to Kevin, because we've been working with them on this for quite some time. Yeah,
thank you, Alphonso. We have a rule at Lambda: when somebody says something really well, rather than trying to say it better than them, we just say ditto. So I would just say ditto everything Alphonso just said.
Including that you're a gay man, so that's even.
Yeah, Alphonso said
I didn't know that about Alphonso. That was a good factoid.
Lambda has been working on this issue with HRC for over 3 decades now, and we have an HIV law project headed by Scott Chavez at our Chicago office, We've been very successful in fighting on these issues and fighting a lot of the misinformation. Like we won a suit 2 months ago. The Trump administration has been trying to toss people with HIV out of the military, claiming with no basis whatsoever that if they get wounded on the battlefield, they'll somehow transmit HIV to the other soldiers.
Right.
We brought in all the medical experts who said that's complete nonsense. And the courts found in our favor, and now people with HIV can continue to serve in the military. So I think the one thing I would echo that Alphonso said is that policy around HIV needs to be made based on science. And it continues to be made based on stigma in various areas, the FDA blood ban, the military, in various sectors of society, and that just needs to stop.
And Todd, if you wouldn't mind, I want to just highlight a few other programmatic areas that the Human Rights Campaign has been focused on. It's just helpful for people to know.
Sure.
We issued a research report about 2 weeks ago highlighting how COVID-19 is having a disproportionate impact on LGBTQ people.
Right.
1 out of 5 LGBTQ people live in poverty. 1 out of 5 LGBTQ people don't have access to health care and are not going to see a doctor. So there has been a really disproportionate impact that the virus is having in our community.
Right.
We also issued a public letter regarding the vulnerabilities that people who are living with HIV have with respect to COVID-19, to Kevin's earlier point. If people don't have access to healthcare and they have HIV, they're more susceptible to COVID-19. We also issued a letter to Congress, sort of demanding that the stimulus packages include specific provisions that would be helpful to the LGBTQ community. So now we have an additional $90 million in the Ryan White HIV Care Act. We have $65 million in additional money for housing for people who are living with HIV/AIDS. We have an additional $25 million to carry out activities for homeless youth, and that's really, really critical.
Yep.
And we did a webinar with Lambda Legal recently to talk about older LGBTQ adults. Right. Because we have to recognize that if you're an older LGBTQ adult and you don't have an extended family, or if you're living alone and you're living with chronic illnesses, you're going to be more susceptible to COVID-19, and we want to make sure that we provide our community with as much resource as possible. And then finally, I'll just say on the political end, we are facing the most significant election of our lifetime. And we cannot forget that even as we go through this crisis. So what we're doing at the Human Rights Campaign is making sure that we remind our community and equality voters why this is so important. We have 11 million LGBTQ voters and 57 million pro-equality voters. We've launched an app to make sure that people can communicate about election virtually. We're doing text message Tuesdays, which allows people to sort of interface with each other, and phone back on Tuesdays. What we want to make sure is just because we're in our homes, advocacy doesn't stop. Right. And this election is way too important for us to forget about. And so we're doing a fair amount of work politically as well.
So I want to make a couple comments, and I have a question for Sarah Kate as a follow-on to that. One, we're going to, toward the end, actually give people one example of how each organization can use volunteer help. So I want people to start thinking about that. But I want to comment on a couple of things both of you said. One, in terms of political pressure and multi sort of touch points, because if you think about the work that leadership does from getting companies to advocate and CEOs to advocate around the world, the sort of economic pressure is one engine. You've got the media pressure that GLAAD is bringing. You've got the behind the scenes pressure from an advocacy perspective. The HRC is bringing the political pressure, and then you've got Lambda with the legal pressure. All of those together, I think, makes such a very powerful combination. And I want to call it out because it's strategic. I think too often people don't see the behind the scenes. I know from Lambda board meetings, for example, Lambda actually has a roster of the court cases and trying to map out future court cases and who the judges are and how the sort of community needs to plan and make sure that we're ready for these cases as they're coming down. I know GLAAD has media plans as well in place. I know HRC has all the political pieces. And that's just something as a member of our community and a leader in our community that I'm very proud of. And I think it makes a huge difference. So Sarah Kate, in that same kind of vein, tell me just a little bit from a media perspective, how one, we're able to get more of these messages out. One of the questions we had here in the sidebar was how we can actually help people who are more marginalized. The numbers that we were talking, that I mentioned earlier in terms of the fact that COVID-19 LGBT people are not being tracked, How can we highlight that more? And then someone actually even had a question about asylum seekers and immigrants and refugees. And I know Kevin probably had some thoughts on that as well, or probably Alphonso as well. So maybe just give me your thoughts in terms of how GLAAD is going to approach or continues to approach getting this message out, especially when we have, this guy in the White House who takes 90 minutes to lie every day.
Yeah, it's a great point. It's been a challenge since the 2016 election, is getting our issues featured on the news and our stories being told, whether it's the murder of trans women of color, that is a significant problem in America. So what we are actually doing is a story bank on COVID-19, and we're actually taking, funnily enough, our countable, which is our work that we're doing on the election, like HRC, like everyone else. I think that we understand the power of our pro-equality voters, right? And so we have a strategy around the election and getting people registered and to the polls. It's really a registration, and we're C3, so we don't endorse candidates or anything of that nature. We're also on there. We're taking that format. The reason I'm connecting those two is because we're taking the format and we're doing a story bank of people who are LGBTQ and the COVID-19 issue that we're dealing with head on right now. And so that is, one of the leading doctors in COVID-19 and on the front lines of the research is a trans woman. So we're collecting all of the stories, both good and bad, of the people that we're losing, people who are on the front lines. Locally here, I'm out on Long Island. The head of the local emergency room is a gay man, a nurse. And so we're collecting all of these stories so that we're making sure that the stories about our community involved in this pandemic are being told. But we're also doing it to use those as examples to shine a light on how disproportionately we're being affected by COVID-19, and it's not being recorded and it's not being tracked. And we know it because of what everybody has been saying on this panel, is that it disproportionately affects marginalized communities because of the lack of resources, because of the lack of access. And so we are capturing those.
Well, and I want to thank you for doing that, Sarah Kate, because as we know, stories matter, and that's one of, I think, GLAAD's taglines from many years ago, that telling our stories is how we actually humanize things, and it's not a statistic. What is it? Something like, it was an old quote from World War II. 10,000 dead bodies is a statistic. One dead child is a story, and that people remember the stories, and I think that really does matter. And I think it's a reminder to all of us that in our daily lives as out leaders, we are telling our stories in whatever way we show up. And right now that matters even more than ever. Kevin, tell me a little bit about the disproportionate impact on minority communities, and Alphonso as well. I know, your work at the Tenham Museum, you were actually doing a lot of work on immigrants, and actually you took that museum into almost an advocacy format, which I thought was pretty cool. What are you seeing from either, and Lambda's work as well? Obviously Lambda does a lot of work with asylum seekers. Give me a flavor for what you're seeing and what people need to know.
Well, one of the things that's really disturbing is that the process of considering asylum cases has pretty much been suspended during this crisis. And people are being kept in immigration detention indefinitely. And I want to be really clear with people who immigration detention is a euphemism for jail. People are being kept in jail. And the conditions under which they're being kept are basically breeding grounds for COVID-19.
Yeah.
So they're being put at tremendous risk. And these are not people who have committed crimes. It is not a crime to seek asylum. It is a legal act under American law to come here and seek asylum. These are not people who have done anything wrong. They do not deserve to be punished in any way. And yet they have been locked away into breeding grounds for a potentially fatal disease indefinitely. So let's be really, really clear on what's going on here. People who've committed no crime are being put at risk for their lives. So I think the LGBT community And let's keep in mind, a lot of these folks are LGBTQ, people fleeing some of the 71 countries where it is still illegal to be LGBTQ, hoping to start new lives here in America from places like Chechnya, which you mentioned the great film made by David France earlier, Welcome to Chechnya, where the government is rounding people up and putting them in jail and torturing them because they are LGBTQ. They're fleeing to America, hoping for new lives, only to be put in immigration detention / jail, where they are at risk for contracting COVID-19. So I think it's incumbent upon our community to speak out about this issue right now and to demand that these people be released from immigration detention immediately on their own recognizance until our system for considering their hearing is functional again and they can be given their day in court.
I couldn't agree more. And I want to underscore a couple of things that you said. You mentioned 71 countries. In 27 states, it was 28. Virginia just passed, inclusive legislation 8 weeks ago, I guess. But still in 27 states, people are being fired for being gay. For trans, 34 states. Our leadership did an LGBT climate index that we launched last year, ranking all 50 US states across 20 publicly identifiable data points, everything from HIV criminalization to non-discrimination in housing, employment, et cetera. And we're continuing to update that with a lot of the information that you just mentioned in terms of people having access to the very rights that these people are trying to have from an immigration and asylum perspective. Alphonso, I know that you guys have been doing a lot of work on the immigration and asylum front as well as the youth piece, and Kevin and Sarah Kate probably have thought there as well, especially given Kevin's background founding GLAAD. Let's talk about that. 40% of homeless youth in the United States identify as LGBT. That has only gone up in this crisis. One of the organizations in the UK 3 days ago issued guidance to kids in the UK not to come out in isolation with their families now, and Sarah Kate mentioned it a little bit ago. Let's talk a little bit about what you guys are seeing, immigration and asylum, but also on the youth front.
Sure. Kevin ditto said it very well on immigration. A few things I'll say on that. One, Welcome to Chechnya is a film that I hope everyone gets a chance to see. One of our board members, Justin Makita, is actually a producer on that film. We supported that film. We think it's an incredibly important film that highlights the disparities that LGBTQ people face in the global space, especially when they're trying to seek asylum in this country. Another sort of point that I want to make here is, one is personal for me. My family sought asylum here in the United States after a civil war. Even though I'm a US-born citizen, my family are not, and they sought asylum here in the 1980s. And it was not easy then either, but it's impossible now because we have an administration that is essentially flouting the rule of law. They're ignoring that you have decades and decades and decades of court decisions that have effectively said, if you're suffering from persecution in your home country, you can come to the United States and we will evaluate your case. We won't simply put you in a cage and keep you there for days and weeks and months. So what we've been doing at the Human Rights Campaign is working with organizations like Lambda, organizations like the ACLU, and other organizations that are working on this issue to make sure that we can advocate for immigrants' rights and push policy and also push law. We've submitted amicus briefs to the US Supreme Court. We have joined in a variety of cases to make sure that people understand how important it is that we protect the rule of law. Because today, if it's your neighbor, tomorrow it's going to be you, right? The rule of law has to be honored, and this administration unfortunately has ignored it. With respect to the youth issue, as you mentioned, 40% of homeless youth classify as LGBTQ. And those kids end up homeless. And we have to make sure that we provide meaningful support and resources for them. So at the Human Rights Campaign, what we're doing is we have a program called All Children, All Families. And that program is really focused on educating social service districts about LGBTQ competency. What we don't want, and what we've seen in parts of this country, is an LGBTQ kid is thrown out of their home. They end up on the streets. They may end up in foster care. And if they end up in foster care, the foster care agency is not competent to actually address the issues. and they end up placing them with a family who will end up victimizing those kids even further.
Even if they allow them to be placed with LGBT couples, because so many states now have passed laws that allow foster care agencies, I think 13 states now allow foster care agencies to discriminate against gay and lesbian couples simply based on quote unquote moral beliefs. So it's even more challenging in a lot of these other states, despite the
incredibly challenging. And it's not just a social justice issue. This is a human issue. These kids are going through a process where they're being victimized over and over and over again. And so we're working on the programmatic side to make sure that we can provide meaningful resources to educate social service districts. And we're also coordinating with organizations, again, like Lambda, ACLU, and others to fight back when we see discriminatory policies being advanced.
So if I jump in for a second, Todd, because I want to make this very, very real for people. Because when Sarah Kate spoke earlier, I couldn't help but think of something that I learned by email yesterday. I support a local LGBTQ youth group that a friend of mine runs in Hartford, Connecticut. And she emailed me yesterday that one of the leaders of the group killed herself yesterday. Because she is isolated with a family that does not accept her. And after 3 weeks of that, she couldn't take it anymore. So this, what Alphonso just said about this being a human issue, Gary, this is not an abstraction. These are young people who are at risk of losing their lives because they are incarcerated in homes where they are subjected to hate every day right now.
And on that note, I just want to say the Trevor Project, because I see in one of the comments people are asking about LGBTQ suicide. Trevor Project is an outstanding organization that is specifically around LGBTQ and suicide. And they've seen, Amit, who is the executive director there, said to me yesterday that they're seeing weekend over weekend, it's doubling the call center. So they have a call center 24/7 and they are working around the clock. So if there is anybody who's in trouble, please call Trevor Project first and foremost.
Yeah, I believe it's 1-800-TREVOR, is it not?
Yeah, 1-800-TREVOR.
1-800-TREVOR, yeah. And I would underscore that. I mean, I think I've got the same note from Amit in terms of the doubling. And, the marginalized communities as well, the trans community, the fear factor there. There are a lot of challenges that are happening. So the last section I want to focus on, and we'll continue to take folks' questions as they come through, and the high school principal that wrote in the mental health supports, the LGBT youth. I think Trevor is a great resource for that. Glisten that Kevin actually founded is a tremendous resource as well. But the last section I really want to focus on is what the folks on this phone or this video cast can do, both to support the organizations, from a fundraising perspective. Obviously, it's a challenging time to ask for money right now, for not just our community, but for anyone, because there's job uncertainty, people have been laid off. Obviously, the stimulus package will be helpful, but not entirely sure, quite how that will go. And in an homage to one of the smart folks on the COVID task force, I want to add one final feature to my ensemble. If you've seen our Deborah Birks and her stars, I felt like it would just be important to add just a little sparkle, a little something, a little pop of color for our final piece here. So and I warned Alphonso that I would do this, but not Sarah Kate and Kevin. So. Because we have to at least keep a little sense of humor, because it is a challenging time, but we also are a gay community and we can be fabulous. So with that, Kevin, let's start with you. Actually, let's circle back. Actually, I want to close with Kevin because I asked him to kind of do a little bit of a retrospective. So Sarah Kate, let's start with you, please. What can the organizations that are out there do? What can the leaders on this call do? How can people support GLAAD in this time?
Sure. Well, thank you. And I would say thank you for tuning in. I think that you attract a large corporate community based on out leadership. And I would say that we're working on a virtual pride. We have a lot of corporates that we work with who are still very interested in in participating in Pride, especially mostly in June. And so we're talking to them all about a virtual Pride. But I would say also encourage your company to continue that outreach. I think it's really important, as we're all talking about isolation. Isolation in corporate America exists too. And so I think any way that we can connect in that way, you can always go to GLAAD.org. That's 2 A's, GLAAD.org. Please become a member, join. There's multiple ways to participate. There's always a petition to sign, always a way to activate on campaigns that we have going on. And I would just say, we are going to announce shortly, so please sign up for our email, a fundraiser we're going to work with Centerlink. There were a couple of questions that I saw in the comment section about what are the local organizations. We're working with Centerlink, which is sort of the epicenter or the connector of all local LGBTQ community centers.
Yep.
And that we're going to filter donations through them, and then they'll disperse them. But it's going to be a star-studded lineup. It's going to be really fun, and it's really less about fundraising and more about connecting and bringing our community together in this time. As Kevin was saying, as Alphonso said, it is so important that we stay connected as a community. And if people are hurting, that they're reaching out. And so that's what we'll be doing, and we hope you'll join us.
Thank you, Sarah Kate. Alphonso, before I turn to you, just a quick comment, and I'm glad you mentioned Pride. Our leadership is also working on a virtual Pride platform with all of our member companies, and we're going to make sure to connect with what Sarah Kate and GLAAD are doing. We're actually calling it Proudly Resilient, which I'm excited about. It will be a month-long celebration with a number of pieces of research that we'll be launching, ideally a virtual concert, and it'll be a fundraiser in part for a lot of the great organizations that we're proud to support. So excited to make sure that as a community we do connect, because I completely agree with you, Sarah Kate. It's so important that we connect in general, and we love to connect, and we're really good at it. So, and this time to make sure that we're doing it as much as ever. So Alphonso, closing thoughts on how people can support you and HRC.
Well, thank you. Thank you for hosting this, Todd. I would say that when I think about the question, I think about community. And this crisis is forcing us to really think about how we define community. I would ask everyone who's listening and everyone who you know to remember that the organizations that are doing this work, Human Rights Campaign, GLAAD, Lambda Legal, we do need the support. So don't assume that these organizations will continue functioning without support. We need the corporate support, we need the individual support to make sure we can continue to do the work. The crisis that we're facing, the health crisis that we're facing, is unfortunately exacerbating the challenges that we're facing. We will continue pushing through, but we do need support from folks, even though it's really, really difficult right now for some folks. Second, I would say it is really important that you register to vote and find 2, 3, 4 people to register to vote as well.
Yep.
We want to make sure that people can exercise their constitutional rights to vote. We want to make sure they're informed about the election. We want to make sure they engage. And then finally, I would say volunteer. At the Human Rights Campaign, we have a platform called Community Hub. You can find it at www.hrc.org. And Community Hub effectively allows you to engage in your community and volunteer. You can volunteer to support a political candidate. You can volunteer to engage in other types of activities. But I would ask folks to think about how they can volunteer to really support our community. So from fundraising to providing monies to the organization to actually have us operate, to register to vote, and then finally, volunteering is going to be critically important right now.
Thanks, Alphonso. I agree, and I think something that I'll see if Out Leadership can do is also, we put together on our webpage, we have a daily COVID update that goes out, but we've consolidated all the corporate resources that have been put towards COVID. So Ropes and Gray, one of our global sponsors, just today announced that they have a fund that they're working through. Baker McKenzie has fund. So many of the firms have been doing work as well that all of the organizations and individuals on this call can leverage. But what I'd love for us to do is add to that some of the resources that each of the organizations in the community are doing. I know, obviously, the Asylum Seeking from a Rainbow Railroad. I know Stan Sloan from Family Equality Council has put together the Neighborhood, which is a great, amazing way for for families of LGBT people and LGBT people with children to connect. There's some really great resources that I want to make sure that everybody is aware of. And someone on the chat here just mentioned the census. Absolutely. I just filled it out yesterday, actually, and it was fun to be able to say that there's a same-sex person in my household, who's totally awesome anyway. So last but not least, Kevin, I'd love you to share both what people can do to support Lambda, but also, as I chatted with Kevin before, I want Kevin to kind of close it out from a top-level perspective in terms of his perspective, given the work he's done in the community for so many years. So, Kevin, over to you.
That's Todd's polite way of saying that I'm old AF. No. I would say two things. First of all, neither Sarah Kate nor Alphonso nor I know where the Terminator is coming from next. So go to all of our websites, GLAAD.org, HRC.org, LambdaLegal.org. Sign up for our action alerts, because that's the best way to keep in touch. As they come at us, we will tell you what you can do next. The second thing I'd like to ask you to do for Lambda specifically is, as I mentioned earlier, our help desk is open and operational. If you know of people whose rights are being violated, send them to us. Either go to lambdalegal.org or call 213-382-7600. And we will connect you to resources and attorneys who can support you. But I think the reason Todd asked me to go last is because in 1994, I was part of the committee that helped create LGBTQ History Month. And I also back then was a scared little foot soldier in ACT UP, sitting in the last row in the LGBT Center in New York City, doing whatever I was told to do. We had a phrase we used to chant a lot in ACT UP. And it was, people with AIDS under attack. What do we do? Act up, fight back. And for the last few years since the advent of this administration, the attack on our community has been relentless. But as a historian, I want to remind you of what our community does when it's attacked. In the 50s, when the Lavender Scare occurred and President Eisenhower signed an executive order saying that LGBT people would not be employed by the federal government, we had heroes like Frank Kameny and Barbara Jennings who organized pickets of the White House in 1965 and said no to that. In 1969, when the police routinely came into LGBT bars and roughed people up, we had heroes like Marsha P. Johnson and Sylvia Rivera at places like the Stonewall who stood up and fought back and said no. When the government turned its back on us during the AIDS crisis and let us die by the tens of thousands, we had heroes like Larry Kramer and Peter Staley and countless others who organized ACT UP and who put their bodies on the line on the streets of this country and who forced the government to take action. And it's time, it's our generation's turn. And I know our community will rise to the challenge, because we always rise to the challenge. So get involved, take a stand, act up, fight back.
I can't think of a better way to end today's conversation. Kevin, thank you. Sarah Kate, thank you. Alphonso, thank you. Thank you to everyone for tuning in. I appreciate all the work everyone on this call and on this webinar are doing. Stay safe, stay sane, and thank you.
Thank you, Todd.
Thank you.
Thank you.